Hey everybody, my name is Wendell Halikami, a third-year nursing student from University of Mindanao. And for today's video, I will be going to perform a return demonstration about IV therapy. So it includes starting IV infusion, regulating IV flow rate, and discontinuing IV infusion. So without further ado, let's start. Starting an intravenous infusion is the giving of liquid substances directly into a vein. So here are the step-by-step process of the procedure. First is to check the doctor's order and make an IV label. This is to ensure that the client receives the correct IV solutions and medications as needed, as ordered by the physician. The next procedure is to wash hands. This prevents the spread of microorganisms. Gather all the equipment and prepare the IV solution and tubing, because having all equipment available saves time. Check for IV solution's color, clarity, and expiration date, and maintain a aseptic technique when opening sterile packages and IV solution. This prevents the contamination and IV solution and set which can infect rapidly the client. Note tubing for kinks and obstructions. Move the roller clamp about 3 cm below the drape chamber and close the clamp. Clamp tubing, uncap the spike and insert it into the entry site of the bag or bottle as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle. Suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it to fill at least halfway, as this suction effect causes fluids to move into the drip chamber and also prevents air from moving down the tubing. Remove the cap at the end of tubing, then release the clamp and allow the fluid to move through the tubing. This is termed as priming the tubing, as this allows fluid to flow until all air bubbles have disappeared. This removes air from the tubing, which can in larger amounts act as an air embolus. Close the clamp and recap the end of the tubing, maintaining sterility of the setup. Hello ma'am, I am Wendell, your nurse for today. Can you state your name ma'am?
Kiara Donaire.
Can I check your ID ma'am? Okay, Miss Donaire. So for today ma'am, I'm going to start an IV infusion to you ma'am, which includes administration of medication intravenously. Is it okay to you ma'am? Okay, so let's start. Hand the tourniquet to the doctor or nurse, followed by a cotton balls with alcohol and the needle of the Vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one good characteristic of a nurse. Release the tourniquet and connect the tubing to the needle. Start the flow of solution promptly by releasing the clamp of the tubing. Then examine the site of signs of infiltration. Support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. Next step is to adjust the rate of flow according to the doctor's order. The physicians prescribe the rate of flow. Then complete the label and tape to the IVF bag or bottle. Do the aftercare of the equipments and wash your hands. This deters the spread of microorganisms. Document the procedures and client's response. Chart the time, site, device used, solution, and rate of flow, and the physician or nurse who inserted the needle. This provides accurate documentation and ensures continuity of care. Monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. Accurate infusion rates are essential in the delivery of solutions and medications. A client achieves therapeutic outcomes and fewer complications when an IV system and flow rate are assessed systematically. Review the accuracy and completeness of physician's order in client's medical record for client name and correct solution, type, volume, additives, rate, and duration of IV therapy, and follow the 10 rights of drug administration, as this ensures that correct IV fluid is administered.
Miss Donaire, please ko dili siya kayo ipatarog-tarog imong kamukha kay mag-backflow siya og dugo and maka-affect siya sa flow rate. Okay lang, ma'am?
Perform hand hygiene, then inspect IV site for signs and symptoms of IV-related complications such as pain, swelling, or redness, because complications indicate need to establish patent IV access. Observe for patency of IV tubing because IV line must be free of kinks, knots, and clots for fluid to infuse at proper rate.
Hi ma'am, can you state your name, ma'am?
Cara Donaire,
When was your birthday, ma'am?
July 28.
Okay, can I check your ID, ma'am? Okay, Miss Donaire.
Have the paper and pencil or calculator to calculate flow rate. Use mathematical calculations to obtain correct rate. Count the drops per minute in the drip chamber, then hold the watch beside the chamber. Holding the watch next to the drip chamber allows the eyes to focus on the drops, and the second hand on the watch to provide an accurate count. Document the type of infusion, amount, flow rate, and client's response to the prescribed infusion rate. Discontinuing intravenous infusion is when the client no longer needs IV fluids, IV medication, or access for emergency drugs. So here are the step-by-step process of the procedure.
First step is to check the physician's order for discontinuing IVF.
Wash hand and assemble equipment. Having all equipment available saves time.
Miss Donaire, I will discontinue your intravenous infusion based on doctor's order. You are completely well, your condition is stable, and you're ready for discharge.
Don gloves and clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle on the client or bed. Loosen the tape at the venipuncture site while holding the needle firmly and applying counter-traction to the skin. Movement of the needle can injure the vein and cause discomfort of the client. Counter-traction prevents pulling the skin that causes discomfort. Hold the swab above the venipuncture site, then withdraw the needle quickly by pulling it out along the line of the vein, as this prevents injury at the vein. Apply firm pressure to the site using the swab for 2 to 3 minutes. Pressure helps stop the bleeding and prevents injury at the vein. Check the needle or catheter to make sure it is intact. Report a broken needle or catheter to the nurse in charge immediately. Discard used supplies appropriately. Then remove gloves and wash hands. The dressing continue to pressure and cover the open area in the skin, preventing infection. Record the amount of fluid infused on the input and output record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing the infusion and the client's response, as this ensures accurate documentation of client's response. So those are the procedure of IV therapy from starting, regulating, and discontinuing. Thank you for watching, guys, and stay safe and God bless us all.